So another important cell which in multiple myeloma, specifically now monoclonal antibody called CD38, they are targeted, and the name of that is called daratumumab. DARATUMUMAB, daratumumab. So these are very specific for multiple myeloma. So why I am speaking about multiple myeloma is because in our team there is a patient with multiple myeloma who's been treated with NK cell, T cell, and along with the ones which I have told you, and he's attained complete remission. So there are a lot of studies which have shown that cancers are now having good cure, in the sense not cure, they are completely, they can be kept under control or check. Most importantly, apart from all these treatments, the important thing is diet. Diet is one thing which we need to know. What type of diet? Very surprisingly, what I have been talking all the while, cancer starts with C and carbohydrate also starts with C. So both C's don't go well together, meaning if we eat more carbohydrates, cancer cells grow. So one anecdote is, or important point to remember, PET CT scan which is used to detect cancer cells, PET scan, before doing that the patient is given injection of glucose. So when glucose IV injection is given, the CT scan picks up where these glucose is going, and the cancer cells immediately absorb, take up all that carbohydrate, the glucose. So that is when the CT scan picks up that, oh, this is a cancer cell. So with this you know that we have to reduce the amount of carbohydrates which we take, sugar, refined sugar in all forms, and maida, polished rice and polished wheat. Very, very important, dear friends, for cancer also. Diet is extremely, extremely important, along with the NK cells and T cells which I am talking about. So in breast cancer, apart from this NK cells and T cells, another inhibitors like PD-1 and PD-L1 inhibitors, they are called checkpoint inhibitors. And how do they help? They ensure that the cancer cells which are evading the radar of the immune cells, normal immune cells in the body, this checkpoint inhibitors proteins, they go and ensure that the wall is broken off, the Scud missile can easily go and find out the areas where it is below the radar. So if there are cancer cells trying to escape, if you inject this PD-1, PD-L1, they can easily detect the cancer cells and blast them off.